Right, good morning, everybody. So good afternoon, even. So I just come straight off a training course from this morning as well. Hayley, do I have the control of the presentation?
Yes, yeah, you've got control of that, so it should work.
Brilliant. Lovely. So good afternoon, everybody. First of all, I just want to check. So I'm just sharing my screen. Can everybody see the screen that I've just started to share?
Yep.
You can. Lovely. Okay. Just going to move people up a little bit. Lovely. So like I said, good afternoon. My name is David Wise from Forward Leeds. I'm hopefully you've heard of Forward Leeds. So like it says there, we are the Leeds Integrated Alcohol and Drug Service for the city. Been going about sort of 7 years, this sort of coming July time. And my job is some lead brief interventions trainer with the Forward Leeds service, doing lots of training. So training every day, really doing a session for professionals across Leeds, and we also sit as a larger part of early intervention team where we're doing lots of public events and lots of public information. So we're going to look a bit of alcohol awareness. This is one of the sort of main sessions we do, and this has been cut down. So during COVID, we kind of been online like most people have. We've cut our sessions down from a full day to sort of like 3.5 hours. And I've just picked on a few bits now for 30 minutes, so been cut down quite drastically as well. So hopefully a little bit of a quiz at the sort of beginning, really the main part of the session, and obviously hopefully get some factual knowledge, knowledge across basically. A few little fun questions, perhaps looking at sort of public perceptions and how sort of alcohol is kind of marketed as well, really. So I'm going to start with the quiz. Let's get that going through. So just a few questions, and hopefully, like I said, it will highlight some of the kind of work and knowledge we're trying to increase across. So I'm not sure how many people we've got on the session. We could definitely I could give a chance for people to have a little bit of, obviously, think about the question and have a shout out. If anybody's not okay to shout the question out, then obviously I will give a little bit of time and people can obviously mark themselves and I'll go through, some of the questions and answers. Okay, so the first question we're going to look at really, how many alcohol units do the government currently recommend men and women not to drink more than? So this is a major part of the kind of work we do. We're really big on trying to, I suppose, demystify really around some of the confusion around, a unit, what is a unit of alcohol, and obviously different drinks and different kind of unit amounts really. So this is a lot of work we do with the public to increase our knowledge. So looking at those results then, so we've got 2 to 3 a day for females, 3 to 4 a day for males. Then we're looking at some weekly figures, and then is there government guidance at all? If you remain standing, you can drink as much as you like. So anybody willing to have a bit of a choice and shout at which one they might think might be the correct answer?
C, 14 for both.
C, 14 for both. Lovely, like that. Yeah. Anybody else?
I was going to go A, 2 to 3 for females and 3 to 4. Oh no. No, that doesn't add up. No, I take it back.
No, you're fine. No. Right, so those two answers are really good. Okay, so what we're looking at, the first one, so A was correct before 2016. So this is where some of the confusion sort of lies really. And there was a study done by sort of the Roundtree Mackintosh Foundation, and they looked at a lot of kind of the warnings and the information on a lot of product that is obviously on the shelves at the moment is still not up to date. So we are talking since 2016 the guidance has changed. But yeah, so if you said A, partly correct. So 2 to 3 a day for females and 3 to 4 a day for males was since 1996 to 2016 was the actual guidance. So we're looking at a daily amount. Person who said C, fantastic, you're spot on at the moment. So we are looking at the moment, it's changed from a daily amount to a weekly amount, and we're looking at 14 units a week for males and females. Okay, so the first one would equate to 14 for females and 21 for males. So the male limit has been brought down in line with the female limit of, so it's 14 across both genders. Okay, in 2016 there was, the decisions were made to update the information. We now know much more information around sort of medical conditions, I'm not going to give the second question away, don't worry, but it's kind of like this, obviously, you know, seven cancers that are directly related to alcohol. So even in the last couple of decades, our knowledge has massively grown around sort of alcohol and health. Yeah, so 14 units a week for both. So the second question, how many medical conditions does alcohol contribute towards in recent figures from Public Health England? So what do we think? So anyone want to have a guess?
I'm going to say 40.
40, okay, lovely. We'll start with that. Anybody else?
I feel like I've been wildly optimistic now, though, looking at James's answer.
Okay, right. So what was James saying?
So James has put D over 200.
D, brilliant. Right, so let's go with that as a correct answer. That is true. So it's at the moment, and I say at the moment because in sort of November 2019, that these are updating all the time. So this just shows how much knowledge we know. It basically was 80 conditions related. And when we say contributing or related to, we're talking about hospital admissions. And we know there's sort of like a 3.5 billion cost to the NHS for, you know, kind of alcohol related conditions. We're updating our training all the time. I think it was literally 8 or 9 months later during kind of COVID lockdown times that we got updated figures, and it was, yeah, it's over 200 conditions now. So like I said, our knowledge is kind of expanding all the time, even as we're, you know, in recent years, basically. Yeah, so over 200 conditions alcohol contributes towards. Great, thank you. Okay, so look at the next ones. Oh, do that. Okay, so this is I suppose a lot of knowledge for the general public, really. We're trying to, I suppose, break down perceptions, what people have, and kind of what they've heard, how the media kind of portrays a lot of questions in relation to alcohol. So we're looking at age groups. So which age group is most likely to drink more? Now, 8 units a day for men or 6 for women is going back to the old guidance. It's almost like having a double daily amount. So who's drinking double when they're having a particular, you know, perhaps sort of session with alcohol? So there we go. So 11 to 15-year-olds starting with all the way through to 65 and over. So what age group do we think are drinking double the recommended sort of amounts?
I'm going to say C, 36 to 44.
Brilliant. Okay.
65 and over as well, I'd have thought, in some cases.
Yeah, I was torn between the two there.
Yeah, it's good to be. I mean, when we do this with the general public, I suppose, talking about, once again, perceptions of people, you know, perhaps how it's portrayed in the media, perhaps what people are seeing, you know, and I suppose it's much easier to see the visible signs of alcohol rather than perhaps what we call sort of home drinking, which is obviously behind doors. So we would think, and most people do think, sort of 16 to 24-year-olds, I suppose. So, you know, so a kind of younger age group still get that kind of negative rap in a way. I suppose it's what we kind of, perhaps people think, oh, that's the time people are sort of coming into, you know, perhaps drinking age, you know, sort of just around this sort of age of 18, etc. They're out and about, perhaps it's more visible. So that's normally the perceptions we get. It actually, spot on, who already said D, it is 65. It's 65 and over. There's also an increase at 65 to 75 and then 75 and over. There's actually there's a further increase as well. So definitely those brackets, 65 and over, are drinking and consuming the most alcohol.
And it's on a daily rate, you're saying there. So the younger people probably do more of a binge drink just at weekends.
Quite possibly, yeah, certainly. So we're looking, I mean, age, the studies also show that when we look at various universities, the universities and colleges around Leeds, the information we're getting now is even some student unions are basically sort of closing down their bar areas and opening up more sort of, you know, Starbucks kind of coffee cafe kind of area. So I mean, it was sort of Newcastle University, I know it was Nottinghamshire University as well, reporting basically more and more the drinking decreasing with alcohol. I mean, my niece has just started at she started at Manchester Uni, and she, you know, I was quite excited because I've been there. I was quite excited to show her into some of the bars, and she said, "Oh no, we just, you know, a kind of coffee voucher, put some money on a Starbucks card for me because that's where we kind of meet up for, you know, even sort of tutorial groups. We're not drinking at levels that people were before." So it is interesting. There are also reasons for 65 and over. A bit of publication here, we have actually just started this year a new training session called Alcohol and Older People, and it's really good looking at some of the kind of statistics and reasons why those age groups are drinking more. You know, we're looking perhaps if you're lucky enough, it's retirement age, you might have a bit more time on your hands. Children have obviously, you know, fled this open nest kind of syndrome. There's also things as well, as we get older, we're going to have obviously more health conditions. The body also slows down. There's a really quite polite term called functional decline, where our body's obviously just slowing down. We're not metabolizing, perhaps, you know, the alcohol as much as we are. We might be having sort of bereavement for the first time amongst peers and friends. So it's a really interesting time, actually, with sort of, you know, people's drinking habits around 65 and over. So they're really just really to break some kind of perhaps, you know, misconceptions around age. Next one, how long does it take for your liver to process 1 unit of alcohol? So what do we think for this one? 5 minutes, 30 minutes or an hour? What do people think?
Yeah, I agree with you, James. I think, is it an hour?
It is an hour, yes. So as a rough guide, so when we're doing lots of talk around sort of perhaps, you know, harm reduction, increasing knowledge about how the body, you know, metabolizes alcohol. Yeah, so 1 hour, 1 unit once you've stopped drinking. And this is the important bit. So the liver, you know, fantastic organ. This is our kind of, you know, sort of filtering and processing sort of the alcohol in our body. So yeah, so lots of knowledge around this. Really important for people to understand perhaps, you know, what time they might have started drinking, how much they've consumed, and therefore working out, you know, the morning after, it's not necessarily going to be without checking, you know, how much alcohol you've kind of had. You can have a rough rule, and obviously this isn't legal by any means, but you can obviously have a rough rule about how, you know, when is the body going to be fully cleared of alcohol, basically. Lots of things will come into play with that. You know, we do look at sort of, you know, the tolerance of someone's drinking, someone's sort of size, the kind of biological makeup, but as a standard thing, it's basically 1 hour. Also, if you've been eating as well, so people think, you know, one of the things is obviously to have something to eat, which is really, really true, but it's not going to be processing that food until it's basically processed all the alcohol. So once it's kind of started, those cravings we have of, you know, sort of pizza, kebab, burgers, etc., is actually sort of sitting in our stomach until basically the alcohol has all filtered through. And it will be the things we crave are normally fatty carbohydrate, which does take a lot longer for the body to kind of process eventually as well. Funnily enough, nobody ever craves a salad in the early, after perhaps after drinking, on the way home, etc. Yeah, we're not looking at salads, we're looking at kinds of food that if we had it before, so if we line our stomach, that's great, especially with kind of sort of fatty carbohydrate food, but not after we've been drinking. Okay, the next ones. Okay, so a little interesting one here. So we put this in. I was quite interested when I found out the kind of answer for this, really. We used to have lots of very clever marketing through alcohol. We're picking up on Guinness here, or particularly stout. So we used to have a tagline, Guinness is good for you. Don't know if anybody remembers that. We discussed in our training, obviously, you know, a little bit of stout or something was kind of recommended. So you could actually, at one time, you could actually go into hospital to visit a relative and loved one and actually have a little drink with them, etc. Obviously appreciate how times have changed now, but what do we think? So how many pints of Guinness would you have to drink to obtain your recommended daily amount of iron? So it was all about the iron in Guinness being good for you, but how many pints would you have to consume? What do we think?
I mean, this is quite topical as well for today, isn't it?
Well, yes. Oh, yes, of course. Basically, yeah. I've got Irish family members as well, but yeah, there we go. So without knowing, I've actually included it on today. Perfect. So how many pints of Guinness do we think we would need to drink?
James is typing something. I'm going to leave this up to him. I should imagine it's going to be quite a lot. 30, James has put in the chat.
But James, not bad. It's actually 33 pints of Guinness you would have to drink. So if you wanted to get your recommended daily amount of iron today, yeah, 33 pints of Guinness. So therefore, we don't have the tagline Guinness is good for you anymore. Okay, so people not just a pint or a couple of pints, but yeah, 33 pints. Okay. 6. So this is quite an interesting one. Which of these is an effective way of sobering up? There you go. So we've got a cup of coffee, some fresh air, making ourselves sick, having another drink, having something to eat, or none of those. What do we think?
I'm going to say fresh air and walking.
Okay, fresh air and walking. So really good. Yeah. So that we do talk of people perhaps if they've been inside drinking, obviously, perhaps quite tired. I mean, alcohol is a depressant drug, so it's going to, lower all our bodily functions, lower our heart rate, perhaps make us feel quite tired. So yeah, we talk about getting outside, don't we, and having some fresh air to revive ourselves. I
would have said none of these, because isn't it more how long alcohol's actually in your system? You don't sober up, do you, just by eating something and things like that? You've got to let it go through your system, have you?
You have, yeah. So you're spot on. You're correct. So none of those is an effective way of sobering up. So anybody know the only way to sober up? What's the most effective way to sober up?
Not to drink anymore.
Yeah, brilliant. So yeah, certainly not to drink. It's basically time. Okay, so time is the only thing. So like we said before, 1 unit, 1 hour, we have to wait for the alcohol to fully clear our system. So interesting ones on some of these, and that's why we've included them. So definitely B, the fresh air and walking. So fresh air and walking is once we get oxygen back in our system, it almost like it back into our bloodstream, we fire back up again. It can actually work the alcohol back around your system again. So you almost have a kind of second phase or second flushing, basically. So at the time, it can slightly intoxicate us again. The same as coffee. So coffee being a stimulant drug, once we have a stimulant in our bloodstream, it can resurge the alcohol back around our system. So the first two there can actually make us feel more either more intoxicated or more under the influence, basically. And then the others, yeah, I mean, you can make yourself sick. There may be a certain percentage of alcohol that's in your bloodstream, which will obviously come out when you're being sick, but nowhere near enough. Hair of the dog, not basically all the hair of the dog is doing is basically topping our levels kind of back up. So there's lots of other things that go on when we're drinking as well, blood pressure and so forth, and that's just kind of topping that up. And like I said, having something to eat, but not necessarily sobering up, but it will just basically line our stomach and stop us from getting drunk or intoxicated so quickly. Yeah, so nothing apart from time is going to sober us up. And we know, there are lots of I suppose urban legends around having coffee and walking around and getting fresh air. Okay, so just a couple more. So for the first time, government recommends some advice on reducing some risks from drinking. Which of these do they recommend? So along with the change from daily amounts to weekly amounts and the lowering of the men rate to 14 units a week, somebody mentioned binge drinking as well. That's an interesting term. So we all still use it, but what we're apparently supposed to use now is single episodes of drinking. Okay, so you can be your own judge. It's basically the binging, the wording, the terminology that we're trying to avoid. It is unfortunately how a lot of people do drink in this country. Do kind of drink to excess on sort of individual sittings or single episodes, as we're supposed to say now. But along with that kind of guidance, what else were the government telling us? So which ones of those do we think? So limiting drinking more slowly, water, or all of them?
All of them.
All of them. Yeah, brilliant. We'll go with that. So, spacing and pacing is the kind of terminology. So in a lot of advice, it doesn't work by saying to people, please don't drink. It doesn't work by saying people, please limit the amount of time you're out, just perhaps an hour or a couple of hours. These things aren't going to sit with people. So it is lots of advice. So it is basically, if you're out drinking, just monitor how much you're drinking. So drink more slowly. Limit the total amount of alcohol. That could be consider the number of drinks you're having, or it could consider thinking about a lesser strength alternative. Okay, so a lower percentage alcohol. Obviously, drinking. So we talk about having perhaps some non-alcoholic drinks between your alcoholic drinks, and that includes, that's obviously including water. And there is a little bit said about avoiding risky places and activities. So there are sort of studies that show that people may take more risks once they, once they're intoxicated or have alcohol in their system. So not risky, but perhaps even unfamiliar places. And we do lots of work with the universities in Leeds, perhaps students, first time away from home, first time in a new sort of city, etc. There can be, lots of advice we can give about avoiding risky situations or unfamiliar surroundings. Okay, so all of those come into play holistically. And then last one, I've included the last one because we started right at the beginning of this, didn't we? Looking at, what is the limit, the unit allowance recommendations, these kind of words. So this first started, so government recommendations and guidance started in 1979. The Royal College of Psychiatrists looked at kind of accidents through alcohol, hospital admissions and so forth, and they actually set a limit. So no limit, more than 56 units a week, or no limit as long as you don't mix your spirits and beer. So this is about mixing alcoholic drinks. What do we think?
I mean, I'm going to guess I've got every other single one wrong. I'm going to say no limit.
Okay. Enough. Anybody else?
Yeah, I think probably no limit at that time.
Okay. Yeah, no, good guess, to be fair. That may be the case. It actually was, it's actually B. Okay, so I suppose it shows how far we've kind of come, really. So no more than 56 units a week was the government guidance back in 1979. Obviously down to 14 now. It seems a long, I appreciate 1979 was a fair time away, but yeah, no more than 56 units. In the sort of early 80s, it got reduced to 38 units a week. And now we're at the current, obviously moved from 14 and 21, both down to 14. Yeah, so, and have lots of discussions in our training, so especially professionals who've, worked in nursing for a number of years, as well as sort of telling the stories about, sort of, I suppose, drinking in the wards and so forth. But how things have really changed since 1979 and are still changing in a way. We've talked about there about the age groups, it's sort of younger people aren't drinking as much. So we may see a lot more obviously changes in the next sort of 15, 20 years. But yeah, no more than 56 units, which seems a massive amount at the moment. So really just to sum up, this is just some of the sort of graphics we use. So I think more importantly, I know we've discussed 14 out a week. The bit there at the bottom of the asterisk, it's best to spread this evenly over 3 days or more. So this was further advice they were giving. And it was a little bit of a debate about, can I have a drink every day? Or am I to save up my drinking during the week, but then only drinking perhaps a couple of days a week and having the rest of the week off? It's really come through as kind of inconclusive. The really important bit is having time away from drink for your liver to recover. So they've made it simple, even more simple than 3 days. They basically said have more alcohol-free days than alcohol days at the moment. So, just trying to put those very simplified messages across basically. The next graphic, so obviously it points out the 200 medical conditions. I mentioned the 7 cancers. So, Cancer Research UK massively expanded our knowledge. So mouth, throat, stomach, liver, breast cancers for both genders, and colon cancer for men. So we can appreciate the root of the sort of the alcohol coming into us. Cirrhosis of the liver, is really important. It's what most people will pick up on, but we probably are looking much bigger. 60 to 70% of health around alcohol is to do with the heart. So once again, being a depressant drug, it's going to affect our heart. Cirrhosis of the liver and liver transplants, obviously, do hit the headlines. They're very kind of prominent, but it really is, like I said, the heart disease, the strokes and so forth. And then obviously, please don't forget a mental health side, so kind of anxiety, sleep, problems with sleep, problems with memory, all those kind of things come into play as well. We're looking at overall health and alcohol. And just finish on this slide. So this is really interesting. So we obviously talk about units, but we're very visual learners. So this is really looking at some studies around glass size and drinking habits. So we're starting on the right there. That's a 125 ml, a small glass of wine. So we may have these in the back of our cupboard. Obviously, you can buy them from sort of charity shops, quite sort of trendy at the moment. Middle one, I believe is like a 125 again, slightly larger glass. Medium-sized glass, next one, and then right up to the full size, so 250 ml, like a large glass of wine, basically. And that is 125 ml measure in each. So it's kind of the kind of industry is working towards having larger glasses, part of what they call the kind of the theatre or the experience of going out and having a drink. So they're trying to, you know, think of different ways. How is going out for a drink different to kind of home drinking? So it is all about the experience, as they talk about now. And you can see how small a 125 looks, you know, in a large glass. People talk about being a thimble of wine, or a very small amount. So it works ways where people are perhaps topping up their glass a lot quicker. So yeah, really interesting study I wanted to point out to you. And it says there, yeah, so that's looking at glass sizes from 1700 to 2017. So a study called A Measure of Our Time, which is really interesting to look at some of the social aspects of alcohol. And that, yeah, so this is really just looking at, I suppose, the larger, we talk about people drinking individually and then a ripple effect of how people's drinking can affect others, community and society. And this is a Public Health England infographic just illustrating the vast array of how alcohol can affect society. Okay, so that is it. Thank you very much. That's my little bit done. Just trying to check we do, yeah. So this is our details towards the end. So please check out the website for details of all the services that Forward Leeds offer, all the campaigns we run, and all the training, you know, free training we can deliver for people, and then obviously info at Forward Leeds is a very important thing, looking at kind of referrals and gaining information for your clients and yourself, family members, etc. Okay, and that's my part done. Thank you very much.
Thank you so much, Alison. I've just seen you've got your hand up. Are you wanting us to stop recording to ask or speak?
I'm absolutely fine. Not a problem. First of all, thank you. I found that really useful, really informative. Yeah, I mean, alcohol awareness is something that's really close to my heart. I lost my sister through not being an alcoholic. And so I do sometimes find myself a little bit like watching people and thinking, oh, you shouldn't be doing that. But I think one thing that I've noticed quite a lot recently is when I have gone out, it's the different strengths of alcohols. Yes. So we'll have the wines and people saying, well, I'm only having a unit, but actually when you look further into it, the strength of that wine's a lot stronger than maybe another wine, or the same with whiskies and things like that. And I don't think enough is actually publicised about that.
I think you're spot on. Yeah, very quickly. That's another major part of the training we do, but I didn't have a chance to go into it in the time. But you're talking, yeah. I mean, what alcohol is always increasing. So a bottle of wine is now increased from sort of 9 or 10% alcohol volume up to anything up to 14 or 15.5%. So we now drink less European wine and we drink more New World wines. So lots of wines kind of, you know, Australia, New Zealand, South America, much hotter climates, more sugar, more alcohol, and really big trends in beer drinking at the moment. So especially with craft beers, breweries, we're now talking, if someone says I've had a pint of beer, it could be anything from 5% up to 9.5%. Yeah. So when you said, oh, I've had a couple of pints, we're always checking out, you know, where someone's drinking and what they're drinking, because people aren't realizing the massive increase in strength. Yeah.
Thank you.
No worries. Thank you. Okay. Any further questions? Okay.
No, it doesn't look like it.
Brilliant. So if not, thanks very much. And like I said, all the training we offer is free. So please check out the website and book yourself on and come along and have a session with us.
That's brilliant. Thank you so much for your time today, David. I appreciate, obviously, it is quite hard to cram it all into a half an hour slot. So thank you. That was really enjoyable, actually, with the quiz. Like it's one of those ones that really gets you kind of thinking about it, because I don't think we do realise. Well, I clearly certainly didn't have a great amount of knowledge on it, so no, I thought that was brilliant. Thank you very much.
No, you're welcome. Thank you very much for inviting me this afternoon.
All right, thank you. Take care.
Thanks
Thanks very much.
David. Bye.
Cheers,
Thank
David.
you.
Bye.
Thanks, folks.
Thanks.
Bye. Bye.